in the chat as well. Just give everybody a few minutes to sign in.
I apologize in advance. I have to drive downtown for a meeting at 12, at around 4:30-ish. But I wanted to make sure I got on the start of the call. Can you help me with your pronunciation of your name? Is it Cicada? Is it
That's pretty close, Jim. It's I tell people that my parents screwed up the world. So it's Chakata. So it's more of a CH. So it throws
okay?
everybody off.
Okay. Well, it's nice to meet you. We have not met yet, and
No, nice to meet you as well. I've heard a lot of great things about you. So the pleasure is certainly mine.
also haven't talked to my real close friends.
Yeah, you can blame Mike. You can blame Mike.
Just because I like to talk, I'd like to just thank. My name is Jim Miller, and I'd like to just thank everyone who's sort of starting on this journey with us. And my sense is that, at least our experience is that we start small with amazing people and things grow big. And I think over time, what we're starting on as a journey will be something that will be significant over time. And just to give you a sense, we started with 10 universities and we're now working with 78. And when we started the program at Ohio State, we started with 7 students to start this military community advocate program, and we're now at 125 and growing. And so I just think that what you all will be doing in this health and wellness pathway initiative over time will grow. And I don't think that we should be dissuaded by a small group as we start this, as the thing continues to grow. And we capture the imagination and the value proposition that's attached to this. It will be amazing over time. And so for the students who are starting this, thank you so much. For the people who are involved with it as sort of, I'm going to say, mentors or volunteers, thank you so much. And Mike and Laura for your leadership in terms of trying to get this thing moving and off the ground. We're doing it on the fly, and I think over time it's going to just become very, very valuable to us.
Jim, I know we got just a couple folks here right now, but again, I don't know on timing if how well we'll do. But again, we are recording this session, and then we will send it out to our 76 schools afterwards, including all the folks that are in the pathway. For those that don't know me, I'm Mike Carroll. I'm the COO of NVLF. Welcome to the first session for the health and wellness pathway. We have 3 fantastic speakers that you're going to hear from today that I think you'll find a great breadth and a great depth in their area. This is the first session, and one of the things we will do is follow up with the health and wellness students after they've either attended or had a chance to watch this to see if this is meeting what their expectations were and where they might want to go for the session later on in the winter, early spring. For those that are on, if you have any questions throughout, you can either pop them in the chat or when finished up, if you want to raise your hand with the electronic little hand, and I'll watch those. I will monitor the chat and then pass on any questions to our speakers. I do want to thank Mr. Eric Gentzel, Dr. Jonathan Liu, and Dr. Mrunal Shah for speaking to us today. I think it's going to be a pretty cool mix, but giving you a bigger picture of what the health and wellness career, I don't know if I wouldn't want to call it a career field, but all the areas that are out there, some commonalities, some things to think about as we get started down this pathway. And as you start thinking, whether you're hey, I'm just thinking about it, or you're fully committed and I'm, in pre-med or whatever it might be, or I'm actually in medical school. We do have some of those folks. So we can accommodate all those things, but I think you'll get a good mix from them. And with that, I will turn it over. I think, Eric, are you going to speak first?
Yes. Yeah. Thank you, Mike. Appreciate it. So I think we're going to start with introductions on our side, and then we'll kind of go into our agenda. So I'll begin, and then I'll go to Jonathan, Dr. Shaw, and then back to me to start through what we're going to share. But nice to meet you all virtually. I'm Eric Gentzel. So just a little bit about me. I am an Army guy. I've been in the Army almost 20 years, active duty for 5 initially, and then reserve for almost 15 now. So in my reserve capacity, I teach what's called the Army Command and General Staff Officers course. So I have the great privilege to teach the next generation of military leaders. Typical, I guess, Army background, went through, various leadership positions as a platoon leader, company commander, battalion executive officer. And then when I left active duty, I went into mostly a consulting and healthcare career. So spent some time at Deloitte, a larger consulting firm, and then Navigator Management Partners, mid-sized company here in Columbus, Ohio. And then I spent almost 7 years at Ohio Health, which is probably more germane to this conversation, and worked in their enterprise project management office, and then was a operations director as well. And had some pretty interesting experiences during COVID that I'll touch on a little bit. But that's a little bit about me. I will go to Jonathan next to share a little about him.
Hello, everybody. Dr. John Liu here. First and foremost, thank you so much for everything that you do for us, our communities, and for our military-connected communities as well. My story is pretty simple. So I went to college and very first year decided that was not for me. So I did what everybody does in college when they lose their mind and have no sense of purpose or belonging. I joined the United States Army and continued to do that for 20 years. 8 years as a combat medic in the regular Army, 12 more in Special Forces land as an Army Green Beret. Recently retired out of the U.S. Army in 1 July, so just about 6 months ago. From First Special Forces Group, my last position there was as the Senior Enlisted Medical Advisor and Chief Medical Operations NCO. Found myself on terminal leave, thought to myself, I'm going to live out this retired life, and quickly got vetoed with prejudice by my wife on that one. She told me to go find a job, and probably recognized that I was getting a little antsy. I went on the Google machine, found a position as the director for Center for Health Professions here at Wright State University, my hometown and home sweet town. And so what I'm going to do then here is just create a student environment where we have pre-health students aligning towards the health professions, whether it's pre-med, pre-dental, pre-veterinary medicine, but creating a student success pipeline that affords them the opportunity to explore the health professions with curiosity and ensure that their pathways are consistent with and true to their own deeply held identity and personal values. I'll turn it over to Dr. Shaw next.
Hi, good afternoon, everybody. I think one thing that I will start with is I am a grateful civilian, grateful for the armed services and the freedoms that you protect for us. So to all of you that have served in the military, I am grateful. So thank you for that. I am a family doctor by background. I went to medical school back in the 90s. I trained at Riverside Hospital here in Columbus, Ohio. Took a very interesting career journey, and I'll summarize it like this. I was offered opportunities that maybe I didn't even realize were possibilities, and I took chances along the way. Happy to unpack any of that in the future if anyone is interested. Went on to become a teaching attending in our residency program, then went on to be the equivalent of a CMIO back before we even knew what the internet was going to mean for doctors. So that does make me sound old. I get that, but anyway. And then I did that for almost a decade, helping build technological platforms that advance patient care, help physicians with their workflow, open digital hospitals. It was a blast. I loved it. But I think my real calling came next when I had an opportunity to be a chief medical officer for 2 hospitals. I don't know how familiar everyone is with the role of chief medical officer, but the key things there are organizing the medical staff. Medical staffs are often independent and separate from how the hospital is run operationally. And for some very complex reasons, there are strict rules that we have to follow in terms of how we support physicians, how we credential them, how we do peer review, that sort of thing. And it's the chief medical officer's role to ensure that the quality of the care that's being provided at your institutions are the best it can be. I'll use the word excellence because it will come by later. And then as I did that, I had the opportunity to learn what it took to help physicians be successful. So I tried a corporate role after being a CMO, figured out that what I really want to do is help physicians and those in healthcare be successful. And that ranges anywhere from helping people reconnect with their purpose, all the way up to, or also inclusive of people who want to lead in different ways, and, you know, and beyond. And many times, physicians and nurses and physical therapists and pharmacists and anybody in healthcare who might be really, really good as a clinician are often given roles in administrative capacities, but without the background, training, education, support, coaching in order to help them be successful. And that, I think, is one of the things that I wanted to bring into the space is how could I help support people on that journey? So that's what I do now. I left Ohio Health as an executive and started my own business around physician coaching. I have actually several clients around the country that are not physicians, but those that have clinical backgrounds and the struggle that they may have in leading in administrative roles. So that's the short version. Happy to unpack any of that someday otherwise if people are interested, but really looking forward to spending a few minutes with all of you today. And so I'll turn it back over to you, Eric.
Thanks, Dr. Shah and Dr. Liu. So again, great to meet you all and look forward to chatting more. So just to kind of share at a high level what we plan to discuss. So I'm going to start with focusing on the why and purpose. Dr. Shah just talked about that. Great segue a minute ago. And then Dr. Liu will talk about, you know, focusing on your how to make the best transition. And then Dr. Shah will finish with talking about how to be successful in healthcare with a focus on preventing burnout. So as we start thinking about why and purpose, I'll kind of just begin actually with what I do now. So I don't think I included this in my my introduction, but currently I spend half of my time leading a veteran mentoring nonprofit. That's how I got to know Mike and Jim, called the Overwatch Partnership. And then I spend the other half of my time as a project management consultant, as an independent contractor. So I will share just a very quick brief plug. Overwatch Partnership is a veteran mentoring nonprofit here in Central Ohio. So anyone here is welcome to sign up if you're interested. We are currently located in Ohio with plans to, I think, eventually scale more broadly, perhaps. But if you're interested, I can put our website in the chat later. But just wanted to give a quick plug because we work with a lot of great veterans like you all. So talking about, you know, your why, I mean, I would begin with sharing that of the, I'd probably call it the hundreds of veterans that I've interacted with during my time, both in the military and outside of it. I think finding your why and your purpose after transitioning from military service or being a military family, I think is, to me, one of the most important things that you really need to focus on. And I think sometimes it's very natural to kind of jump past that and look immediately, you know, for what you're looking for in your first job, or maybe, you know, applying for a role. And so I would really encourage you to really focus on, you know, what is it that's important to you, and focus on your why and your purpose. I frankly wish I would have done a bit more of that when I first left active duty, because I think it is really, really important. And I think specific to kind of the veteran community, from my experience, it's what most veterans, I think, struggle with upon leaving the military and going into either civilian life or work. Because sometimes you might go into a different, you know, ecosystem or company or organization that is just so different from the military, and you lose that. And I had that experience, and I'll talk about that in a few minutes. So, generally what I share, and I'm oversimplifying this a little bit, but as you begin to look at, what you're interested perhaps in the health and wellness space is, kind of a triangle of, what are you passionate about? What do you really enjoy? What are you good at? And then the third is kind of the hygiene factors of location and, pay and balance and things with your family. And I will admit that that triangle is not always easy to match up. I think sometimes you can get one or two of them, but getting all three at the same time, I think is harder than people think. So I would personally recommend you start from that perspective and think about your why and your purpose. I think why a lot of veterans, struggle with purpose is because, if you're part of a military family or a unit or you're on active duty, it's a very unique institution. And, every day you wake up, I would tell you in the Army, didn't love maybe everything I had to do every single day in the Army, but I always, believed in what I was doing, and I had a lot of purpose behind it. And you make that transition into, maybe a corporate type of job. Sometimes that's very different. And I think that's a hard transition for a lot of veterans to go from that to something that is so different and maybe not so purposeful and might be, more around, financial motivations, for example. So I think that's why, to me, I see that as such a common struggle that a lot of veterans really have a hard time with that. And, I know there's some, some statistics that think, can't remember if it was the Chamber of Commerce. I can look for the link in a little bit, but 44%, I think, of veterans, leave their first job within a year. And I think oftentimes that's either being overqualified for or missing that purpose and connection that they have. So I do think it's really important. And I'll kind of finish before I go on to Dr. Wu next, just sharing my own journey and going into healthcare and maybe some lessons learned that I can share with each of you, because my path was a little different. That I got out of active duty, I went to grad school, and I had an idea about what I thought I should do. And frankly, I think a lot of advice of the typical veteran jobs, hey, you should go into maybe consulting or business operations or things like that. And I didn't really think of healthcare as an option, to be honest, because unlike, Dr. Shaw, I am not a smart like physician. I'm just a guy that, was an engineer in the Army. I'm not clinical, and I didn't really think about that as an option. And so I thought about more of the traditional corporate roles. And I wish I would have, in retrospect, thought about healthcare, because I think healthcare, from my experience and my time working for a large health system at Ohio Health, is I think it's one of the closest mission and purpose-filled types of industries that you can be in compared to the military. Every day when you go to work, you're helping patients, even if you're not the one treating them. I distinctly remember many times walking through the hospital and, going to meetings and seeing families and patients, and then, having had my own family in hospitals and realizing how important it is. I mean, everyone needs healthcare at some point in their life. And so it's a really, really important area of our society. So I think healthcare is a fantastic place to go in. You'll find, I think, a lot of, veteran or veteran connected folks in that space. And, lastly, just kind of from my journey, I, in a roundabout way, ended up at Ohio Health kind of by happenstance. And I had a really great experience. I worked in the project management office, got to work with some fantastic, really smart nurses and physicians and pharmacists, and do some pretty neat projects. And then COVID happened and things, literally changed overnight. And, my story, I remember, the first day after the schools and everything were shut down here, I went in to work in our incident command center, and I was driving down 315, which the Ohio folks know is one of the main highways here in Central Ohio. And there was nobody on, no one on the road. And, I felt like I was in like a zombie apocalypse movie or something, and went into the incident command center. And honestly, it was, to this day, one of the most similar experiences from, a combat deployment that I had, being in incident command, helping our team respond to this unprecedented crisis. And then I was able to help in the operations command center and work on the COVID vaccine program, and did some really, really incredible, fulfilling things with some amazing people. And so I say all that to say that I think healthcare is a fantastic place for you to go. It sounds like many of you are already interested, which is great. You're one step ahead of where I was, but I would really encourage you to think about your why and your purpose, and what is it that, every day when you wake up and go to a job, what is it that's going to get you out of bed even when it's a tough day or maybe a stressful day. That purpose, I think, will really move you forward. So with that, I will now turn it over to Dr. Wu to talk about the how.
Thank you so much, Eric, and good afternoon, everybody. I'm so honored to be here with each of you. As veterans and military connected students, you all have experienced the meaning of service in such a profound way. And now you're extending that service into healthcare. So it's a journey. I just want to emphasize that it's a journey that demands more than skill and knowledge. It requires really a deep understanding of who you are, what you value, and how you can align those values with your purpose. So today, I just want to talk about aligning purpose with your personal identity and values. For veterans, this can be complex. I just left the military with a strong sense of duty. I'm sure everybody here still does have a strong sense of duty, but the next chapter didn't come with a mission briefing, so we had to define our purpose in new terms. And especially in healthcare, as I've come to find out, this purpose is crucial. It's not just about taking up a new job, it's about finding a path that honors who you are and what you have stood for and continue to stand for and will always stand for. So in the military, our purpose was clear: to protect, serve, support those who are left and right. Every mission, every operation driven by a common goal, but in civilian life, particularly in healthcare, purpose, it just might not be as straightforward. Healthcare, you might face challenges that don't have quick solutions. You're working in a system that can feel complex and chaotic. This is why purpose matters. It's what will keep you focused on why you're here, even when the journey gets difficult. But purpose, it's not a one-size-fits-all thing. Each of us comes into healthcare with different experiences, and as veterans, our identities are deeply shaped by our service. Aligning your purpose with this identity means asking yourself, what am I bringing with me from my time in service? What values did I hold dear in the military? And how do those values guide me now? When you find alignment between who you are and what you're doing, you're not only going to find fulfillment, you'll inspire others through the strength and demonstration of your commitment. So many of us know that the military culture demands complete commitment. In my community in Special Forces, there is an even more intense culture that in many ways expected me to forget where I came from. They asked me to embrace a new identity fully. The team identity, the mission identity, the Green Beret identity. And it wasn't just encouraged, it was practically a mandate when I was there. Leave your past behind. I know many of you here have been told, we don't care how you did it. This is how we do it here. They'll always tell you, because you're here, this is how we do it. And for good reasons. It builds unity. It helps create the cohesion needed to face those extreme conditions and survive. And when everyone fully embraces that singular purpose, the team is powerful and resilient. This identity shift, it comes at a cost. In accepting an organizational culture so completely, there's often very little room to hold on to the personal values and identity that made you who you were before. So it raises a critical question in my mind. How can we commit to an organization's values in transition if we aren't fully aware of our own? If we don't take the time to recognize and affirm our personal identity, we risk losing touch with ourselves. And when we leave that organization, as we do when transitioning out of the military, it becomes a problem. Suddenly, without the uniform in the team, without that built-in structure, we might find ourselves unsure of who we are or what we stand for outside of that organizational identity. In the military, our value was tied to our role. Our identity was tied to the team. But once we're outside of that environment, the successful transition back to civilian life, and especially in fields like healthcare that I'm just seeing now raising our future healthcare professionals, it requires us to understand our own personal identity and values in a way we just may not have needed to while in service. So think of it this way. If you're trained to adapt and take on the values of the organization without first grounding yourself in your own values, you're left vulnerable when that structure is gone. Without clear understanding of your own identity and values, there's a void, and the adjustment to civilian life can be disorienting. So acknowledge and affirm your personal values. We have to take that step back from time to time, look beyond the organizational culture we're adapted to, or the one that we're being asked to adapt it to, whether it's the college environment, whether it's the employment environment, whether it's the pre-health environment. Ask yourself, Who am I? What values have always been a part of me? How do I want to serve now in this new environment? And when we do that, we gain clarity and confidence. And we become able to choose organizations and roles in the civilian world that genuinely align with who we are, rather than simply adopting an identity because it's expected. So in healthcare, for example, we can find ourselves better able to connect with patients, build trust with colleagues, and make ethical decisions because we're acting from a place of alignment with our own principles, not just adopting another organization's culture. Those values in the military, integrity, honor, selfless service, they're needed just as much in healthcare. It wasn't just a word on the wall or in a creed, it's the basis of what we did. And in healthcare, that same commitment to values will be crucial as you make decisions that impact people's lives. Your commitment to doing what's right, even when it's hard, is a value that will set you apart. So, as veterans, you bring resilience and adaptability that healthcare desperately needs. You know what it means to stay focused under pressure and to adapt when things don't go as planned, and to push forward when it would be easier to quit. These qualities, they're not just assets, they're a continuation of that service mindset, and they will what make you competent, not only competent, but exceptional in our healthcare system. So to align your purpose with your values, you got to be clear what those values are. I encourage you and encourage you some more. Take time to ask yourself, why did I choose this field? What do I want to stand for? What kind of healthcare provider do I want to be? It's not a one-time thing to do this either. It's an ongoing process. You regularly reflect on your values and your why, you're going to be better prepared to navigate those changes and challenges with clarity. So you bring something invaluable, a commitment to serve, a dedication to your values, and the resilience to face any challenge. Aligning your purpose with your values, your personal identity and values will allow you to bring these strengths into healthcare in a way that is authentic and impactful. It's part of that larger story, one that started with your service and will continue with the mission to make a difference. It's a story of growth, of learning, and of deepening your commitment to serve others. And I assure you, when you align your purpose with your identity and your personal values, you bring a strength and authenticity that will inspire others to make a lasting impact. So thank you so much. I look forward to having a discussion with you. I'll pass it over to Dr. Shah here, but I just want to affirm very quickly that your very, very best is still yet to come.
Wow. Yeah. Thank you, Dr. Liu. That was really insightful and kind of a nice segue. So I think you've heard a few terms come up here so far today, and I'm going to dovetail off of a few of them. While we were really prepared, I guess I didn't realize how well we were going to be able to coordinate our messaging. So this is really great. First, I'll say your military service. I've heard words from my colleagues that were in the military, words like duty, excellence, service, protection. When you talk to someone, when I have had a chance to speak to someone who has a military background, they often will say things like, it's been my honor to serve. So again, I just want to say that I thank you for your service and that commitment that you've made to protecting the safety and security of our nation. So thank you for that. Healthcare, interestingly, you've heard it come up a few times, shares many of those same things. Duty, excellence, and service are often words that you'll hear when you work with anybody in healthcare, whether it's administratively or clinically or otherwise. Those are the same qualities that we look for. In my experience in healthcare, the greatest aspect of it for me was the privilege to be a human serving humans in a way that I don't think any other profession can say that they can serve. It is truly an honor, in my opinion, to be in healthcare and to be able to serve patients, often in times where they are most scared, most sick, most confused, most worried. And that face, that hand, that confidence, that the words you might use could change the trajectory of someone's course. That is a privilege and that is an honor. I share that with you because as you are considering healthcare as a profession, I would say there is nothing else professionally as a vocation that is quite as powerful, in my opinion, than being in healthcare. And I think what many would say is that the military has the same exact feeling about being military. You'll see that that carries over. Transitioning into a civilian, if you are able to go down the healthcare pathway, if you are transitioning into a healthcare role, it can be a little scary, a little confusing, a little overwhelming. There's gazillions of options out there. What the heck? How are you supposed to pick an educational pathway and figure out what, where you're supposed to be? One of the things that I wanted to bring to today's conversation is the idea of resiliency. Let me use that as a contrasting term to burnout. Burnout can be defined in so many different ways, and it is a negative term. I mean, it just is. And all of healthcare has been challenged in ways unimaginable all over the world, but definitely in our country. And in that way, burnout was tested. We figured out what it looks like, what it feels like. I suspect, I could be wrong, but I suspect that many in the military could also find themselves burnt out. And what it translates into, in my mind, in my experience, is you've forgotten your purpose. Why are you coming every day? What is it that you're fighting for? What is your compelling why? Why did you choose this pathway to begin with? Maybe you've forgotten that. And that is just as true in healthcare as it is in the military. How we bounce back to our baseline, we all kind of come in with an energy level, enthusiasm, readiness to take on the day, and all of your experiences. That's what you look for. And each day there will be something that could pull you down. And then you have to have skills and abilities to bring yourself back to baseline. That's resiliency. Not being able to do that can be a sign of burnout. So in talking about that, there are two things, and they've already come up today, which is fantastic. So I don't have to go into a ton of detail, but there are two things that I think are really important in helping to solve the equation around resiliency. And the first one is around purpose. And purpose means lots of different things to lots of different people. I love what Eric said. Jonathan said it as well. Purpose is really thinking about your why. I often equate it to finding your gift. And by gift, I don't mean vocation. You don't go to school to find your gift. Your gift is who you are. It's what you bring. It's how you're wired. It's how you think. It's where you came from. It's how your family functions and how it brought something in for you. That gift could be numbers, could be people, could be conversation, could be listening, could be understanding, could be puzzles, it could be a gazillion things. But once you find your gift, that allows you to help figure out then, what is my purpose? There's this concept called ikigai. I don't know how many of you have read this. It's a Japanese concept. It comes out of the blue zones. These blue zones where people live a really long time. And when asked, you'll have 90-year-olds still working in these blue zone areas. You're like, what the heck? Why would you be working? You're old enough to retire. And they're like, why would I retire? I love what I do. Wait, you love what you do. Now that's an interesting thought. You had to figure out something that you love. That's got to have something to do with your gift. Number two, you have the ability, either because you went to school, you went to training, you worked with somebody, you had a mentor, somebody showed you how to do it. So you have the ability. There's a need for that. That need says that society has a need for that skill the ability that you have, and the love for that ability that you have. And therefore it has value, and value can translate into lots of different things, but it could be as simple as people will pay you for it. That's ikigai, that centerpiece that puts all those together. That's ikigai. So then professional identity is the second thing that is so important. Jonathan talked about it already. That the simplest way to think about that, take your personal identity, who you are, where you've been, what's important, and evolve your thinking into what you want to become. The journey is a professional identity journey. It's a formation of that professional identity. There's a pre-formal, formal, and ongoing. Pre-formal is, I'll use a healthcare example, and that is when I was young, I volunteered as a candy striper. Try not to envision the red and white striped shirt and the white pants. That's a visual you can't unsee. So don't think about that. But that led to opportunities for me to start to think, what would it feel like for me to be a doctor? How might I use these experiences to start to formulate what I'm going to become? Then I went to medical school. There ain't nothing more formal than going to medical school. And it is rigorous and it is tough. But you know what was really important is that I got to watch people as role models, mentors, educators who showed me what it could look like. And it started to become a little bit of who I became. And then what's ongoing for you? How do you continue to evolve and determine what kind of a doctor am I going to be? How am I going to show up for patients? What's going to be my opening line when I say hi to the patient for the first time? How do I want to establish trust and rapport? How will I do that? How I do it will be different than how somebody else does it. That's okay. But figuring that out about yourself is really important. The reason this is also significant is that on your journey, you will have opportunities to start to develop a professional identity, and you're doing it now. You being here or listening to this recording later is a part of you developing what your professional identity is going to look like. And healthcare being as diverse and complicated as it is, you are starting to develop your professional identity right now. And then as you start to evolve, you understand your gift, you understand your purpose, you are pursuing a formal educational pathway, you will then start to figure out what that professional identity needs to look like. And then I encourage you to find mentors, role models, educators, advisors, people who can help you understand what that pathway needs to look like. And ask questions of you to not just assume, should I go to medical school? You know, med school is not for everybody. And there could be nothing worse, in my opinion, than going to medical school and hating it. That'd be terrible. But what if what you meant to be was a nurse? What if what you meant to be was a pharmacist? Well, what a missed opportunity if you didn't get asked those questions that could have allowed you to figure out, what is your gift? What is your purpose? What is your professional identity? And where do you want to go with it from here? This is really subtle, and I'm going to give Jim Miller credit. I think Jim had to drop, but I'm going to give Jim Miller credit. I ran into him and we were talking about this a little bit. And he and I had a conversation that really struck me, and I will leave it with this group as something to think about. Along my journey, I learned a lesson. I had to learn what my identity was going to be. I had roles along the way that fit and aligned with my professional identity. And an example was, I was a physician who was in an executive role. I was a physician who had administrative responsibilities. I also had roles, and they did not work for me, where I was an administrator who happened to be a physician. That might sound subtle to you, but it was actually quite destructive. To not know and understand what that difference looks like, it can be destructive. It's erosive. So what I learned from that was how critical it is to understand your role, understand how your identity fits into that role. Don't take roles that don't fit for you, or be quick to determine that it's not a good fit for you so that you can find your next pathway. That's really important. In a similar way, having worked with many, many former military in my roles, I was intrigued by the fact that so many of them might lead with the fact that they are former military, but that can sometimes become a barrier to your growth and your trajectory. Whereas, what if your future leveraged your military background to create a pathway forward for you, so you are who you are, but part of your background is your military experience, as opposed to leading with that, to which then people are like, okay, what do we want to do with that? It needs to be something about who you are and how you got to where you are, what you learned along the way. And that'll be something that you keep inside deep in your soul that's never going to be taken away from you. And then you get to decide how that's going to move you forward in your trajectory, and you get to show up in that way. And the question in my mind was, do you lead with I'm former military, or do you lead with I'm a healthcare leader and I'm former military? So a little bit like that subtlety of I'm a doctor who's an administrator, or I'm an administrator who happens to be a doctor. Sounds subtle. It's a big deal. I will leave you with this quote because I want to get into a discussion. I want to hear what people are thinking about. My favorite quote is from Pablo Picasso, and he said that your mission in life is to find your gift, and your purpose in life is to give it away. I'll leave you with that, and I'll turn it back over to Mike.
Thank you, Dr. Shaw. I really like that last part, and it dovetails with when I worked in the veteran space at Ohio State. One of the things we always talk with our students about is the military is part of your identity. It is not your entire identity. And those that only saw themselves as a veteran or a Guard member or whatever oftentimes struggled. I won't say it was a prerequisite to that, but I often see it when I see professional athletes or coaches retiring, and all they talk about is that. And they don't realize there's a lot more life coming, and their fathers and brothers and friends and administrators and all those types of things that can create that next path for them. And like you said, it's informed by what you did in the past. I do have one question in the chat that I'll start with, but I'll ask all the others. Since there's not a lot of us on here, feel free to come on off. You'll go to camera and we can just have a discussion here, but I'll start with one that it asks about, you all were talking about healthcare as a profession and the purpose of it. Can you have the same kind of purpose if you're not a frontline patient provider, if you work in information technology or accounting or HR or social work? Now social work is directly talking with individuals, but can you find that in your experiences? Have you seen that?
Yes, and I'll start, but then I think I am sure Jonathan and Eric have had a similar experience. So when I worked in IT for a decade, one of the things I started to do was to take my development teams on rounds with me. I was rounding in the hospital every 8th week. I was covering inpatient rounds, and I would let them sign up 2 or 3 at a time. I mean, I was a big team anyway, so what's 2 or 3 more people, rounding with me in the hospital? But what I would do is I would use it as an opportunity to remind those developers that they are building the technology that is enabling patient care. It's a little reminder that you can build technology to run a car, you could build technology that, I don't know, runs a bank, or you could be building technology that is serving and supporting the healthcare workflow, taking care of doctors and nurses and therapists and patients. And how cool is that? So yes, and HR, for example, HR in healthcare is a little bit different than HR in other spaces. How we treat patients, how we behave with each other as teams, those all might, there could be similarities, but if you're an HR leader working in the healthcare space, you're always reminded that what we're here to do is to serve the patient. And that is different. Nobody else can say that unless they're in healthcare. And finance, HR, IT, doesn't matter. Nobody else can say that they're here to serve a patient except for those that are in healthcare in any one of those capacities. So purpose, 100%, but that's my experience. Jonathan, Eric, you can add to that.
Oh, I'm fiery about this one. I love this question so much. I find a lot of personal and professional satisfaction promoting interdisciplinary and interprofessional training within my pre-health students. And really, there's 2 things that I'm instituting in this culture of future healthcare leaders. One of them is that healthcare is a team sport. And no longer gone are the days where we can expect to train the different positions for 4 years, 6 years, 8 years, maybe even 12 years, and then expect them to play a full game of football by throwing them out there into the field, having never played a game of football with other positions or a full team. And so the other one that I wanted to throw out there too is that healthcare, it's not just the realm of the providers anymore. And no offense, Dr. Shaw, like healthcare being a team sport, really the future of healthcare belongs to those that are going to be able to connect the dots between the professionals that are making the system work. irrespective of the roles and responsibilities of their initial formal training. I'll give a great example of this. Judy Faulkner is the founder and former CEO of Epic, which is the largest EHR outside of the federal governments, right? She is the most powerful woman in healthcare and has actually been said as called and dubbed as much by Forbes magazine. And she is not a healthcare provider by training, not one bit. Her undergraduate was in math. Her her master's training was in computer sciences. And if you think that there's not a place for you in healthcare because you're not involved in direct patient care, that's simply categorically false. I can't even begin to imagine the outcomes that have occurred because Epic integrates and creates a field of collaboration amongst interdisciplinary providers created by somebody with a vision that wasn't even a healthcare provider. And so again, just stressing, it's a team sport, and it is the future of it absolutely does belong to those who are going to be able to connect the dots. And I challenge you to hone that skill, just like you did in the military. If you were ever a platoon sergeant before, like you know that your platoon always has the grease guy, the guy that can steal things, the guy that can find anything that they absolutely want. You got your mechanic, your generator operator, and you got the one that's like, in case of war, break glass, and that's the only time he's ever good for anything. He or she's ever good for anything. But as a leader, you're expected to apply those roles and responsibilities towards the mission. And I challenge you to do the same in healthcare.
Yeah, but I'll just add real quick. But great comments by my peers here, and I'll just pick up where Jonathan left off, because I think that, to me, the big analogy is, a healthcare organization, take a hospital as an example. I mean, it requires so many functions to run, right? HR, finance, EVS, so many critical functions. And the military is the same way, right? I think sometimes there's kind of a civilian misconception, like everyone's in the infantry, running around on the battlefield, but it requires so many different roles to make it work, right? And that I've always shared, like, the Army, it's like a corporation, right? You have cooks, you have finance folks. I mean, we have like a postal unit, right? I mean, there's all different kinds of support functions, and I think they're just as meaningful and as important. The one thing I will add to, just maybe as a different layer, because I'm guessing some of you may have leadership aspirations, is just like in the military where, you start at, whatever rank, whether you're enlisted or officer, the higher up you go, you kind of get a little bit more disconnected from, I think, the troops and sometimes the purpose. And I do think that is something to just be mindful of in a healthcare setting, right? I mean, going up the chain and, being in more of a strategic leadership role, well, I think still very important and purposeful. I mean, you're just naturally not going to interact with, the frontline staff and everyone quite as much. That sometimes I see people struggle with that. And then, maybe they decide they want to go back to maybe just being a frontline provider. And I think there's nothing wrong with either one, but that to me is something I see that's analogous in both sides.
I'll throw something out there too, as somebody who knows nothing about healthcare, except using it when I need it. I got some tours of some hospitals, as new hospitals as they were opening, and I saw this theme of those that were contributing to it that were not, but they were just listening to the healthcare providers and the patients. And one was, normally you have a wall with two rooms on either side, and one of them, the bed's on the left and one's on the right, and it comes out. Well, the healthcare provider said that the design team listened to them, spent extra money. And so when they walk in a room, it literally looks the same all the time. Everything's where it should be. So it's not like, is this thing on the left or this thing on the right when I walk into a room? And when you have I don't know if it's called a code red or a code blue or a code something else, but they said, that 10 or 15 seconds that you just saved me may be the life and death difference in helping this patient. And then the other one was an IT design. And it was around children that are getting long-term care, particularly around cancer and serious diseases. When they first came to the hospital, there was a giant board, and they stood in front of it and they input their name, and all these cartoon characters came up, and they picked one and they named it. And every time they got service in that hospital, for the rest of the time they were in treatment, in any room they went to, there was a screen, and their buddy rabbit or bird or whatever would come up, and they were with them for every appointment to put them at ease. And I thought, what a fantastic thing that was done by an IT folks team that listened to the healthcare provider and the patients to do that. So I think those were great examples for me of exactly that issue.
I love that.
Let's open it up for Robert or Dave or Mike or Andrew, anybody who's got some questions. General questions, specific questions, no bad questions today, or even Jennifer wants to jump in.
I would just like to say thank you so much for this presentation. And also, although it was geared towards healthcare, making the connection between your why and your service in the military, this obviously is very broadly applicable. And I would love to see you guys do something that maybe took, say, Dr. Lou or, whoever, and then brought in some other people and sort of had this similar discussion, but maybe to an audience that would be more like, oh, this is for me as well, because this was so applicable to almost anyone. So yeah, I just want to thank you all again.
This is Jim Miller. I'm zooming and driving at the same time, so I'm not on screen. Could you, and maybe Jonathan, you might be the best person to sort of respond to this, but could you talk about your sense of the kinds of things that are important as transitioning military folks are working on their time as students, the kinds of things that you think help differentiate them to get their first choice outcomes in terms of employment? Could you, and maybe others, you will have some ideas too, in terms of the kinds of sort of student experiential kind of things and the other kinds of things that you think just help differentiate candidates when they're seeking sort of their dream job?
Wonderful. Thank you, Jim. So I work in our Division of Student Success here at a public university. It's in Ohio. And I am here to tell you that categorically every military service member and veteran, and even our military affiliated communities, to include our spouses and dependents, we hate talking about ourselves. We hate building anything that's our accomplishments and our achievements. And it is a disservice to to the accomplishments and the wherewithal and the hard-fought experiences that we have garnered by virtue of our service, whether firsthand within the service or as a family member that's served from back home and sacrificed. And so the thing that I would strongly invite everybody here to do is to utilize the services available to you in your universities and in your various institutions, and connect with your career accounts, with your career services and your career consultants. They 100% will objectively take your experiences and make that into and translate that into the civilian lead skate that your civilian hiring managers will be able to understand, but two, that your AI processors, which 80% of all employers now run your systems through your resume or CV through an AI or some sort of automated processor, can detect on, hit on, and return back for those actual callbacks. I can't encourage this enough. As just a personal plug, I thought that I was a pretty good writer. And as it turns out, the product that I had as far as my CV from what I submitted for and got this job, and the product that I utilized or that I got after I utilized such a service here at the university, it's night and day. I might as well have written the last one in crayon. So please, please, please utilize those services. And then the last thing that I would have is, do not allow yourself to undersell yourself. You have done amazing things. You absolutely have. If you would only give yourself the grace to be able to acknowledge that and let somebody else capture that on a piece of paper so that you can work commensurate to what you're capable of.
I can jump in on. I thought Jonathan's advice is perfect, by the way. I see that a lot with the being humble, which is, the way we act in the military, but you have to sell yourself, whether it's in an interview or a resume, in a different way in the civilian world. The one thing I would add too is, and I think this is true both to Jim's question of kind of maybe your first job or opportunity, but I think it's also lifelong and career advice, which is networking. I mean, I meet a lot of veterans that have a negative connotation with networking coming out of the military. I think it's a term that's not used quite as much. And I say this as someone who's introverted, that I have to work hard at networking myself, but it's a really, really important skill. And it's how to personally, whether you think it's fair or unfair, I think it's the way the world works, especially in terms of employment. Most jobs are found through networking. So I'd really encourage you to do that. I really just call it building relationships, building relationships that are reciprocal and getting out and being a part of groups and activities and going to events, even if it's uncomfortable. I think there's a ton of value in that. So that's my 2 cents.
David, looks like you have a question. David Hitler.
Yeah, David, go ahead.
Thank you, guys. So Eric just touched on this a little bit, but I was wondering, being in the military, it was a team sport. You're doing it with your unit, you're doing it with your squad, your platoon. Can you guys maybe talk a little bit about how you have been able to help lead others in your path on where you're currently at in your development, and also how maybe that team spirit that came from the military may have helped you on your journey as well?
Having not been in the military, but having had the opportunity to work with many who have, culture is really important. Culture sets tone for everything that you do. As you take on new roles, new responsibilities, you grow. If you maintain a level of curiosity, humility, as well as decision-making capacity over the course of your trajectory, you will find that teamsmanship is how you will get everything done that you want to get done. And as you ascend in an organization, what you have to get done becomes broader, bigger, deeper, more complicated. And the size of your team might actually be impacted by what you're trying to accomplish. So I think our CEO, when I was at Ohio Health, is former military. And I think what he would tell you is what he learned was discipline, excellence, decision-making, especially in the moment, in the line of fire, you have to make a decision. Having, purpose right in front of you for everything that you're doing, knowing that the more authority you give folks closer to the front line, the better the decision-making will be, and the more sort of protected those folks are at the front line. So I wish I could tell you from personal experience in the military, which I can't, but I've been really observant of those that I've worked with. And so, but I'll turn it over to Eric and Jonathan, because obviously they've been in the military.
Very well said, Dr. Shaw. I mean, I just add, I think, teamwork's obviously huge in the military, right? I think you usually talk about, hey, you're only as strong as your weakest link, and I love the culture part that Dr. Shaw touched on. I mean, I think it's just important, whether it's a small team in healthcare, maybe you have a team of 3 or 20 or 50. I mean, I'm a big believer in team building, doing team building events, whether that's offsites, that's, you go do an escape the room activity or a happy hour or team building exercises. I mean, I'm a big believer in those. I think those go a long way. And I think they can really make the difference in creating a bond and, kind of that camaraderie that and esprit de corps that exists in the military in the very same way.
I would only add that there are a lot of tropes from the military that we are working against, and to and I'm sure many of you are already living it now or have a previous experience in it. To be able to refute those tropes and preconceived notions about what it is to serve and who a veteran is, and how they act is a very gratifying thing. And being able to categorically refute many, not all, of those tropes has led to an open discussion and nice discourse into, hey, so what would you do in this particular situation? And it just creates that culture of true discourse and shared decision making.
Thank you. Andrew, you have a question?
Hey, thank you guys for putting this on. So my project is going to mostly focus on finding internships and opportunities for research in healthcare. Um, and I understand that it's like very valuable, very vital for us to get those in early, and because things are so competitive. Can you guys give some pointers on this area?
Jonathan, you probably might have a little bit more insight on that, and then I can add, at least as maybe somebody who would be evaluating those opportunities and trying to choose them. But Jonathan, why don't you start?
Yes, absolutely. It is absolutely critical to understand the population that you're serving, and it's going to be very specific to you and what your community is going to be able to support in terms of what infrastructure and systems are available. If you do have a large healthcare system in your community, I would start by engaging their talent management suite within human resources, as well as potentially getting in contact with community engagement. It's usually a branch of the human resources. I say that because the traditional approach would have you engage with maybe the volunteer internships piece. But the issue that I'm not running into is it's not capacity. It's understanding the unique skills that military service members bring into these fields and articulating the competencies that they have and are studying in to be able to kind of reassure them that, hey, yes, this is a student, but they also have had a pretty significant experience in there. I think you're going to be in a very prime position to be able to advocate for student veterans that are seeking internships. If you can just find the key decision makers and the ones that hold the keys to those internships and refute those tropes that you have about the military, that people may have about serving the military population. Um, Specifically to healthcare. Um, One of the big issues that we have as far as service members transitioning um, into civilian healthcare is understanding where scope of practice ends and scope of practice begins. And so I would invite, I would try to engage with perhaps the staff development model of your local institution or your local healthcare system and offer up a workshop explaining, the different things about, hey, this is what a medic did in the Army, or this is what a PA does in the Army, because it's drastically different from what they would be able to expect. And so understanding that military context, I think, lends into that discussion and curiosity. And when you transition from that I'm afraid of this mentality to I'm kind of curious about this, I think that's where you're going to be ideally situated to help guide those stakeholders in that transition. I hope that's helpful.
Eric, I didn't know if you had anything you might want to add as well.
Yeah, no, well said by Jonathan. Again, I would pull back a little bit to my previous comment on the networking. I mean, I think internships I think are great, and internships can turn into jobs. I mean, that's the beauty of it. And I would say the other benefit I think is that you're kind of getting a free look at whether or not you like something and whether or not you want to do it long term. I was actually teaching a class this morning. I shared the same thought that sometimes unfortunately jobs or even you don't really know what it's like until you do it, which is kind of unfair. And sometimes you realize you love it, and sometimes you realize maybe this is different than what I thought. And I think the beauty of an internship is you can, maybe try something for a summer and you're like, hey, I love this. I want this to be my career. And if you realize that it isn't what you like, I think that's totally okay too. It will confirm or deny, your preconceived notions about something. Back to the networking piece, I mean, oftentimes, again, like Jonathan shared, I mean, it's getting your resume to the right person. I mean, just broadly speaking, I'd discourage you from just applying to a lot of roles. I mean, I think sometimes that's kind of what people do, but if you have a connection to someone in HR or talent acquisition or that works there, you know, um, getting your resume to the right person or connection there can often go a long way.
I think I'm just going to dovetail a little bit off of Eric's comments here and previously. I think networking is a really important thing. And I know it does have a negative connotation, but I would say finding people in the industry who are helpful, friendly to, supportive of, can be a great conduit into helping build these kinds of connections. And two things I'll add. One, it's a great way to find sponsors and mentors within organizations. You might not know who they are by virtue of their title, but you might find that that's how you might find an inroad into helping to support a subgroup of a population. The second thing I'll tell you is, every organization might have a different term for this, but there are these things growing that are called business resource groups. I don't know every institution what they might call them, but it's kind of an HR term that brings people of like-minded backgrounds, or could be ethnic, could be gender, could be, I don't know. But we had a military BRG at Ohio Health. I left, but there's a military BRG, and if you found out at institutions who is maybe the chair of or the head of that BRG for the military, or whatever they call it, that might be the best way to be able to make connections within those that understand that military background, and could be the voice of, within the healthcare space, how do you find your pathway into into healthcare using your military background, training, education, experience to do what you might be able to do next. So I don't know if that's helpful or not, but that would be the other thing I would add.
So we are at time. I want to be respectful of anyone. Does anyone have a burning question right now? And you will see in the chat that the three speakers gave their contact information. We will include that when we send out this recording, as well as some follow-up questions for all of you on what you might want to see from this group in the future. I want to thank all three of you for, I think, a wonderful, wonderful session. And Jennifer hit it right on the head too. And we'll emphasize this when we send it out. I think folks that were outside of healthcare can benefit greatly from this as well. So this is really good. I'd like to leave you with a thought. This was an old theory of mine, and it warms my heart when I get to talk and work with healthcare workers. It used to be on spouses. I had this theory, and now I've expanded it a lot broader. And I would tell you to think about your spouse or your friends or your children or your brothers and sisters. The people that serve others are drawn to each other. And it's an inordinate number of people that are in the military that connect with those in healthcare and ministry, in hospitality, in nonprofits, in first responders, whatever it might be, and continue to do that. And I believe it is at its core is because they want to serve. It's about something greater than themselves. They have that purpose, and they're drawn to people that have that purpose and have that purpose very strongly. And so it's great to see three others like that. And it's great to see all of our students that I know are entering into that, because again, they want to serve, and they want to serve in a little different way, and take the words to heart about it's just part of your journey. You don't know where it's going to end up. As you heard, all three of them didn't expect to be where they are sitting right now, probably 20 years ago or so. But they've had fantastic paths, but it's all about the service again. And so I think that fits with where you all were, where you all are now, serving as leaders on your campus. And we look forward to down the road, you'll be leaders in healthcare as well. So thank you to everybody. Have a great evening, and we'll be following up with you.
Thanks, everyone.
Thank you.
Thank you, guys.